Next presentation, cost and time analysis of single-port extracorporeal appendectomy for acute appendicitis in overweight and obese patients. Dr. ALFREDO.
Good afternoon, thank you for the opportunity. The authors have nothing to disclose. This is a cost and time analysis of a single-port extracorporeal appendectomy for acute appendicitis in overweight and obese patients. Single-port extracorporeal laparoscopic assisted appendectomy has benefits including lower cost, better cosmesis, and shorter operative times in pediatric patients compared to the conventional triple port. We sought to determine whether single port results in shorter operative times, shorter length of stay, and lower hospitalization costs in overweight and obese patients. It's a retrospective chart review of 299 patients who underwent laparoscopic appendectomy for acute appendicitis over a 2-year period. 2 different techniques were performed, the single port laparoscopic appendectomy and the conventional triple port appendectomy. The patients were divided in 6 groups based on operative technique and BMI for normal weight, overweight, and obese. Operative time, length of stay, and cost of hospitalization were compared. There were no differences in between the 2 groups in terms of age and gender. In here, we see a comparison of the normal weight between the 2 techniques, and you see that there's a significant lower cost, lower operative time, and lower length of stay favoring the single port. In the overweight patients, essentially the results are the same except for length of stay. And in the obese group, the only difference is the operative time is lower. So among all the single port treated patients, weight as an independent factor did not result in a significant difference in cost, operative time, and length of stay. So in conclusion, hospitalization cost was lower in overweight and obese patients operated by the single port technique compared to the triple port, but did not reach significance in obese patients. Single port operative times were significantly shorter than triple port in obese and overweight patients. Weight as an independent factor did not result in a significant difference in cost, length of stay, and operative time among the normal, overweight, and obese patients. Single port should be considered to all pediatric patients with acute appendicitis regardless of weight. Thank you.
Any questions or comments? Please go ahead.
Thanks for your presentation there. Could you tell us a bit about your actual technique for the single port and whether you're using the proprietary single ports that are fairly costly compared to the triple port?
In the single port, we use a 10mm laparoscope with a 5mm working channel and 43cm bariatric length instruments, and we exteriorize the appendix, and it's and the amputation is done extracorporeally.
Do you think some of the difference in cost is accounted for by a difference in the method of dividing the appendix? In other words, are you using a stapler or endo loops or something like that in both methods, or is that an additional
Could be.
cost?
We've looked at 2 more ports, and sometimes in our conventional technique, we use the endo catch bag, so that could probably add more cost to the conventional technique.
Hi, Sean St. Peter, Kansas City. Do you have the same distribution of surgeons amongst groups? Because with a retrospective study like this, it may imply that your single incision surgeon is slicker and quicker than your 3-port surgeons, and that produced these results.
Can you repeat the last part? I'm sorry.
If you had the same distribution of surgeons in all the groups, otherwise this could imply that your slickest and quickest surgeons are doing the single site compared to the others that are doing the 3-port, so that regardless of body habitus, the quickest operations are going to be done by the quickest surgeons.
And in our institution, I believe this is the standard of care right now. So that's what we are, all of the surgeons are doing single port right now.
So you're comparing the current cohort against the past cohort?
Yes.
Thank you for excellent data.